I'm Stuart Ralston. I'm chairman of the Pagets Association, and I'd like to welcome you to Pagets Awareness Day 2025. Now, the focus of Awareness Day this year is diagnosis, particularly ensuring that the diagnosis is made early so that people are picked up and treated in a timely manner. Now, today I'm joined by Geraldine Hilson, who has been diagnosed with Paget's disease and who I met at an information day we had in Cambridge this summer. Welcome, Geraldine.
Hello.
Hi, Geraldine again. Now, I know when I spoke to you, you've been having problems with pain. I seem to recall since back in 2022. So we're now nearly at 2025. So yeah, just go over what initially happened and what your journey was. Thank you.
Yeah. So I was getting pain in my back. I'd been to the doctors several times, and for a start, they thought it was a water infection. Um, I was referred to the hospital where the urologist um, did some more tests and a CT scan. And on that, he noticed that I might have Paget's disease and referred me for a bone scan. And the results from that came back um, positive that I did have. And that sort of from the start of 20, that was 22, that was November 23, by the time all the different various sort of going to different doctors and appointments, scans, and so it was quite a long time before, and I suppose that was by chance as well. And he referred me back to my doctor and said that should probably be referred to a specialist.
Okay.
Going on.
Thank you. Thank you. So yeah, I mean, quite naturally, a urologist is not going to treat Paget's disease. So,
Yeah.
so you got back to your GP. Obviously, the urologist has said we got Paget's disease. So then what happened? Did you get referred to a specialist?
Um, the doctor referred me to a
A
physiotherapist.
physiotherapist.
Yeah.
Okay. I don't want to have a downer on physios, but not exactly who I would think of for Paget's disease. Carry
No,
on.
and I, because I didn't really understand Paget's disease. I googled it, but still didn't really understand it that well. Well, okay, I'll go along to the physiotherapy. And after a couple of days after going to that appointment, the physiotherapist called me and said, there's nothing we can do. You need to go back to your doctor and ask to be referred to a specialist,
Okay.
Paget's disease.
So you're going round the houses now. So there
Yeah.
was yet another referral. Where was that to?
Um, so the doctor then referred me to Dynamic Health, which is, I think they manage pain. I think that's what they do.
Okay.
And I thought again, well, I don't really think it's where I should be, but I'm going to go because I've got to get. I need to see somebody that knows what they're talking about. And that's where I actually met a really nice nurse who listened to what I was saying and was really helpful. And she actually referred me for another X-ray. But in the meantime, after going to that first appointment, that's when I came to Cambridge to the information day and
Okay.
got some more information. So I was then armed with information to go back and say, this is where I need referring to. And it was actually the nurse at the pain clinic that made that referral for me. So I was very grateful for the information day. If I hadn't gone, I wouldn't have really known where or who I needed to see. And I'm very grateful to the nurse at the pain clinic who took it on herself to actually refer me. And since then, it's basically been a roller coaster.
Okay. No, that's good. Well, it's delightful to hear that the information day was helpful to you. So yeah, so as you said, I mean, yeah, I think you were furiously taking down the names of all the consultants in Cambridge. So you obviously got to see, I think it's the rheumatology service that deals with Paget's, and then so you've seen them now, I think, or you got referred, and then what has happened?
So I got referred. I went for the first consultation. Shortly after that, I had another bone scan, uh, and then this and blood sort of blood tests and different things. And then this Saturday just gone, I actually went and had an infusion.
Okay, so at last you've been treated.
I
Um, maybe 3 years. Any after effects? Sometimes you get the flu type reaction. It's obviously early to expect you know, your pain to diminish. Yeah, what about
Yeah.
that?
Um, I had it done on the Saturday. Saturday, I was absolutely fine. And I went positively thinking as well because I thought I should be back at work Monday morning. Um, Sunday, and I could hardly get out of bed. Monday, I could hardly get out of bed. Tuesday, I felt a little bit better. I went back to work Wednesday, and then it came back with a vengeance yesterday. But
Oh,
I am feeling a lot better today. So it's
okay.
yeah. So I think I've come through the other side now.
Okay. Well, you've had a wee bit of a stormy course, and
Yeah.
I know this it is variable. Most people it's very mild. In others, it can be a bit more severe, like yourself. But I mean, all I can say is that if the pain is coming from Paget's, and it sounds like it might be, in 2 or 3 months, I'm hoping things are I would imagine things are going to be a lot better.
Mhm.
Um, so thanks for sharing your story. I think the thing that strikes me as a specialist in Paget's is that you've had to wait like really a long time when considered to get diagnosis, and laterally, obviously, things speeded up for you, and that's um that's troubling to hear. But hopefully, this video or this our trying to raise awareness of this might help other people who are in the same position. So Geraldine, thank you so much for taking the time out of your schedule today, particularly recovering from the zoledronic acid till you're a lot better, and really appreciate your help. And thanks once again.
That's okay. Thank you.